Hello dear students, welcome to GDC English classes. I hope you all are doing well and I hope you are too busy in your Gpat preparation because you know that already the PCA announces and it is going to implementing within soon. The stipend will come into your accounts who completed their Gpat examination in previous years. And in this year means 2025 around May or June, you will go to write your GPAT examination and you will also your stipend. So and still believe that everything is possible, miracles will possible only with your dedication, passion as well as determination. And for success in a competitive examination, it is always important to choose a good platform. So you already choose a good platform and wonderful platform that is Gpat Decision Center, a number one pharma platform across the India for Gpat, Hyperlipidemic as well as pharmacy. And one of the important thing is in 2024 GPAT result, our GPAT Decision Center from our GDC itself, more than 2,500 plus students are qualified in the GPAT examination. That is only because of the quality and content, and students also believes GDC like that. Okay, and we have excellent materials and everything is there, and it's your turn how much time you are spending and how you utilize the GDC content and how you are going forward to get a top rank, and especially from top first to 100 ranks every year, GDC giving wonderful cash prizes to the students qualified in the GPAT examination. One of the important thing to succeed in a competitive exams like a GPAT, you have to be practice MCQs thoroughly. So GDC is always in the front row to give content to the students always. So in the form of MCQs, in the form of recorded videos, etc., etc. So without any delay, so we'll start our session regarding a detailed discussion on MCQs with explanation from Pharmacology Gpat 2023 Shift 1 paper. So let's have a discussion, start our discussion with the first MCQ. So what is the first MCQ here? Sorry. So following is an example of atypical antipsychotic. Following is an example of atypical antipsychotic. So you also know that antipsychotics are drugs. Antipsychotics are drugs mainly for treatment of psychosis, also known as schizophrenia. Psychosis, also known as schizophrenia. Following is an example of atypical antipsychotics. So haloperidol, clozapine, thioridazine, flufenazine. So there are mainly two categories of antipsychotics, typical as well as atypical. So typical antipsychotics are many number of examples like haloperidol, droperidol, etc. Typical antipsychotics acts by blocking dopamine receptors in the brain. We're coming to the atypical antipsychotics, they block both dopamine as well as serotonin receptors. So both are different. Typical only blocking dopamine receptors for treatment of schizophrenia or psychosis. When coming to the atypical, blocks both dopamine as well as serotonin receptors. So here haloperidol, thioridazine, flufenazine all comes under the category of typical antipsychotics, but clozapine is comes under the category of atypical antipsychotics. Atypical antipsychotics. So let's see the answer, that is clozapine. Clozapine is an example of atypical antipsychotics from this option. I hope many times I informed that and many times I told that GDC is always in a front row to give always content make easy to the students, especially who are dedicated to their GPAT preparation. So like this MCQs is always helpful with along with explanation, detailed explanation. Okay. So as you know, this is a classification of antipsychotics. This is a classification of antipsychotics. First one is a typical antipsychotics like phenothiazines, butorphenols, thioxanthin, other hydroxychlines. And atypical antipsychotics like clozapine, olanzapine, all these things. So atypical antipsychotics you can commonly found pine like clozapine, olanzapine, quetiapine, and zotapine. And also you can commonly find done. Both pine and done are commonly found in the atypical antipsychotics. Okay. So clozapine like that, and zotapine like that, and don, risperidone, giprasidone, paliperidone like that. And so you also know that recently GDC released a Gpat mantra, a detailed explanation of previous MCQs, Gpat question papers since 30 years. Okay, next MCQ. So following is not an example of carbapenem. So this is regarding antibiotics. Carbapenem is a beta-lactam antibiotics. Carbapenem is a beta-lactam antibiotics. All beta-lactam antibiotics are cell wall synthesis inhibitor. They inhibit cell wall synthesis in bacteria by inhibiting peptidoglycan synthesis. And all beta-lactam antibiotics are bactericidal in nature. So which of the following is not an example of carbapenem? Like tyramycin, imipenem, piperacillin, meropenem. So meropenem, piperacillin, imipenem, tyramycin. So we know simply piperacillin is not an example of carbapenem. And remaining all our carbapenems belong to the class of beta-lactam antibiotics. They directly inhibit the cell wall synthesis in the bacteria. Cell wall synthesis in the bacteria outside the piperacillin. So this is a detailed classification. So this is a detailed classification of penicillins and carbapenems. Penicillins and carbapenems. So go through it. If you're interested, you can pause and make a screenshots, whatever it may be. So the classifications are always important. You have to know what is the correct answer, why it is only correct answer, and why remaining three options are wrong answers, and know about the details of that wrong answers also. So like that you will prepare means it will helpful a lot to make always you in the race of computer exams. Next, so regarding the next MCQ, which of the following urinary tract anti-infective agent require acidic pH of urine for optimum action? So which of the following urinary tract anti-infective agent requires acidic pH of urine for optimum action? So options like xanthomycin, aminoglycoside, erythromycin, a macrolide, carpenicillin, a class of penicillin antibiotics, carboxypenicillins, and streptomycin, urinary tract anti-infective agent. Urinary tract anti-infective agent. So mostly here, which of the following is a anti-infective, especially against the urinary tract. So for that purpose, definitely. So here, list of the drugs which can also use in treatment of urinary tract also you see, especially carbapenem. Carbapenem, nothing but carboxypenicillin. Carboxypenicillins. So carboxypenicillins are effective on treatment of pseudomonas. Pseudomonas is effectively causes urinary tract infection. Urinary tract infections. So here it is the explanation. So carbopenicillins are generally weak acids. Hence acidic pH of urine decreases. Ionization of carbopenicillin. Ionization of carbopenicillin. The unionized drug more lipophilic, so reabsorbed more and excrete less. So simply carbopenicillin is a weak acid. Hence acidic pH of urine decrease, ionization of carbopenicillin. If the molecule is unionized having the good absorption. Unionized having the good absorption. So let's see the indications, the uses of carbopenicillin. Serious infections caused by Pseudomonas aeruginosa as well as Proteus mirabilis, like burns because of fight, urinary tract infection, septicemia, a infection in the bladder. But more active and better tolerated ticarcillin or piperacillin are now mostly used. Piperacillin are now mostly used. Okay, so let's have a look on the next MCQ. Let's have a look on the next MCQ. Which of the following drug has an apparent volume of distribution approximately 6,500 liters? So this question is dropped actually from the question paper. So because like these questions are rare and it is also difficult to remember, most of the drugs are apparent volume of drug distribution. So which of the following drug has an apparent volume of drug distribution? Option amoxicillin, ibuprofen, chloroquine as well as chloroquine as well as a diazepam. So here, don't worry, these questions are very rare, and here the answer is chloroquine. The answer is the chloroquine. So the answer is chloroquine. Let's see the explanation. So regarding explanation, as you know that chloroquine is an anti-malarial drug. Chloroquine is an anti-malarial drug. Effect on especially Shigella forms of the Plasmodium species. And this drugs possess around the largest volume of drug distribution, that is 13,000 liters. 13,000 liters. And chloroquine is a very large volume of distribution, highly lipophilic, get deposited in the get it deposited in the total body fat, and especially chloroquine may accumulate in the retina and may cause ocular toxicity that leads to retinal damage, and also on heart it may lead to arrhythmias, abnormal heart rhythm. And the chloroquine is one of the anti-malarial drug safely used in pregnant women for treatment of malaria. Safely used in pregnant women for treatment of malaria. So when coming to amoxicillin, 28 liter is the volume of distribution. Ibuprofen 0.1 to 0.2 liter, and diazepam also 168 liter regarding its volume of distribution. So next, match the following concept in list with the parameters in list 2. Okay, first volume of distribution. Sorry for inconvenience. First is volume of distribution. So volume of distribution, Evans blue 3.5 to 5%, metallothioneine. So protein present in kidney to 4. Volume of distribution, measure volume of real physiological plasma, human serum albumin, volume of blood, ratio of drug content to plasma concentration, and the protein present in kidney to bind kidney to bind metal. So here Evans blue. So volume of distribution, you can see volume of distribution means simply ratio of body drug content to plasma concentration. And Evans blue. So Evans blue measures volume of real physical plasma, and 3.52% human serum albumin, and metallothioneine protein present in the kidney bind to the metal. So let's check the correct answer. So regarding the correct answer, you can see one is yes. Yes, we already discussed the volume of distribution is ratio of body drug content to plasma concentration. Next, two is P. The Evans blue measure volume of real physiological plasma. So you can know what is the real amount of physiological plasma in the body, and 3.525%. 3.525%. That is option 3 Q. Option 3 Q. That is 3.525% human serum albumin, and metallothioneine 4 T. The protein present in the kidney to bind the metals. So this is the answer for this MCQ. And this is a clear explanation. So what is volume of distribution, and along with that different plasma proteins present in the body. These different plasma proteins in the body responsible for the drug distribution in the body. And here are the different markers to measure the volume of real physiological compartments. So explanations are very important. So go in detail while you are practicing MCQs. So trastuzumab is an, so the name itself indicating the trastuzumab is a monoclonal antibody. This monoclonal antibody so is an EGFR HER2 epidermal growth factor inhibitor, angiogenesis inhibitor. Angiogenesis means increase or new production of blood vessels. EGF, epidermal growth factor receptors inhibitor, and BCR ABL tyrosine kinase inhibitor. So trastuzumab is a monoclonal antibody. It is an inhibitor of epidermal growth factor receptors. So here the detailed discussion regarding the explanation. So with different targets and different drugs. So go in detail. So trastuzumab inhibit the epidermal growth factor. Epidermal growth factor. Next, when is a new drug application made? So when you have to make any new application for any new drug invented from your side. So when is a new drug application is made? When a new drug application made? So once the animal studies are done and drug is declared safe in animals, once the animal studies are done and drug is declared as safe and effective in animal studies, after the phase 3 clinical trials, after the phase 4 clinical trials. So after the phase 3 clinical trials, after the phase 4 clinical trials, once the animal studies are done and the drug is declared safe and effective in animal studies, once the animal studies are done and drug is declared safe in the animal, and after the phase 4 means, so phase 4 is the post-marketing trials and the phase 3 is the phase 3 gave complete details, sorry, complete details regarding our drug details. So especially because of that only, after phase 3 clinical trials only we will go for the application of new drug. Yes sir, yes we company discovered some new drug and we tested on the animals. Phase 1, phase 2, phase 3, everything being completed. So please give approval for us. We have to go forward into the market. So the new drug application will be made after the phase 3 clinical trials. After the phase 3 clinical trials. So this is regarding the NDA is required after phase 3 clinical trials completion with an excellent and safe data. So this is regarding so drug discovery, preclinical phase, clinical trial phase, regulatory approval, restricted marketing. So let's have a look here for getting more information. Next, so next MCQ is identify the drug that is not among the drugs recommended as first line drug in the treatment of partial seizures with or without generalization seizures. Generalized seizures. So identify the drug that is not among the drugs recommended as first line drug in the treatment of partial seizures with or without generalization. With or without generalization. So you have options like carbamazepine, valproic acid, diazepam, as well as lamotrigine, as well as lamotrigine. So the answer is simply diazepam, not among the drugs recommended as first line drug in treatment of partial seizures with or without generalization. So generalization means generalized seizures means they affect the total brain, affect the total brain. So answer is diazepam, a benzodiazepine category. So here it is, the detailed classification of antiepileptics based on their type of seizures like partial seizures, generalized seizures, febrile seizures, status epilepticus. So go through in detail by passing your video. So next MCQ. The next MCQ is which of the following hyperlipidemic drug acts via G protein coupled receptors? Which of the following hyperlipidemic drug, which are the following anti-hyperlipidemic, not hyperlipidemic. Hyperlipidemic means increasing lipids. So there is a mistake. Sorry for interference. Which are the following anti-hyperlipidemic drug that acts via G protein coupled receptors? So options like nicotinic acid, fenofibrate, atorvastatin, as well as ezetimibe. So I'm also thinking there is also a little bit mistake in the MCQ. So let's have the answer is nicotinic acid. So nicotinic acid, nothing but it is a vitamin preparation. At low dose, it acts like a vitamin. At high dose, this nicotinic having action like a anti-hyperlipidemic, decrease unwanted lipids. Decrease unwanted lipids. Okay. So here nicotinic acid is acts by binding to the nicotinic acid is a anti-hyperlipidemic. It is not a hyperlipidemic, sorry for inconvenience, and it acts by binding to the G protein coupled receptors. Okay, next. All of the following are TNF alpha inhibitors except. All of the following are TNF alpha inhibitors except that is tumor necrosis factor TNF alpha, etanercept, infliximab, adalimumab, basiliximab. So all of the monoclonal antibodies except etanercept. So all of the following are TNF alpha inhibitors except so that is the answer will be the exception will be basiliximab. Remaining all three are inhibitors of TNF alpha element in the body. So here it is a discussion of especially this is a classification of total classification of a immunosuppressants. This is a classification of immunosuppressant and basiliximab is also an immunosuppressant, but it is not an TNF alpha inhibitor. It is an inhibitor of interleukin 2. It is an inhibitor of interleukin 2. So basiliximab, tacrolimus both inhibits interleukin 2 function in the body and suppress our immune system. And immunosuppressants especially helps in the autoimmune disease as well as to helps in the treatment of to helps in the organ transplantation surgeries. So next MCQ will be match the following: matched cells, lymphocytes, T cells, monocytes, macrophages. So matched cells. So for matched cells, you know that there is a interlink with allergic reaction. Lymphocytes, what lymphocytes will do? Okay, so for example, T cells. T cells involves in cell-mediated reaction, cell-mediated immunity, T cells. Lymphocyte, anti-recognition and phagocytosis. Anti lymphocytes, antigen recognition and phagocytosis. And monocytes, macrophages, master of immune system. So mast cells releases histamine and involves in allergic reaction. Lymphocytes, antigen recognition, phagocytosis. T cells involves in cell-mediated immunity. B cells involves in humoral immunity. Monocytes, macrophages, master of immune system. Master of immune system. So let's see the answer. I already explained in detail. The answer is option B. So one is Q. One is Q. Matched cell allergic reaction. One is Q. That is matched cells allergic reaction because matched cells releases histamine. And two is P. Two is P. Lymphocytes, the master of immune system. Master of immune system. Next, T cells. Option 3 are T cells, cell-mediated immune reactions. And option 4 is as monocytes, antigen recognition and phagocytosis. So lymphocytes, master of immune system. Monocytes involves in recognition of antigens as well as helps in the phagocytosis. Okay, so this is a function of mast cells, lymphocytes, T cells, monocytes, macrophages. So go in detail by passing your video. So next, which of the following drug can produce mydriasis without cycloplegia? Mydriasis means dilation of pupil of eye. Cycloplegia nothing but paralysis of the ciliary muscle. Cycloplegia nothing but paralysis of the ciliary muscle of the eye. So which of the following drug can produce mydriasis without cycloplegia? Mydriasis dilation of pupil of eye. So atropine, tropicamide, homatropine, ephedrine. So among these four drugs, first three options are parasympatholytic. They shows opposite action to acetylcholine. And last option is the ephedrine. Ephedrine is a sympathomimetic, especially mixed acting sympathomimetic. So mostly ephedrine does not having any effect on the ciliary muscle. Ephedrine is a Mydriatic. Ephedrine is a Mydriatic. So it causes dilation of pupil of eye, but does not shows any effect on ciliary muscle. So definitely it does not cause a cycloplegia. So cycloplegia nothing but paralysis of the ciliary muscle, paralysis or relaxation of the ciliary muscle. So ephedrine sympathomimetic acts on radial muscle through sympathetic nervous system and remaining all atropine, tropicamide, homotropin, these are parasympatholytics. They act on ciliary muscle. So ephedrine is the answer because of ephedrine does not having action on the ciliary muscle and does not cause Cycloplegia does not cause cycloplegia. You already know that Mydriatics dilation of pupil of eye increases size of pupil. Cycloplegia, paralysis of the ciliary muscle of eye, resulting loss of accommodation of eye. Loss of accommodation of eye. So here it is a myotic dilation of constriction of pupil, and there is a Mydriatic dilation of pupil. Dilate the pupil. Next. So this is regarding the detailed drug discussions also. Ephedrine, atropine, homotropin, tropin. Next. So this is a question many times asked in the Gpat examination. This is simple question, basic question. So what do you mean by orphan drug? What do you mean by orphan drug? A drug meant to be distributed among the orphans who cannot afford the cost of the drug. So the first option is a drug meant to be distributed among the orphans who cannot afford the cost of it. A drug for a disease which is not having any other treatment options. A drug which is useful for rare disease. A drug what is available in the abundance. Orphan drug. Orphan drug. So what is the meaning of orphan drug? The meaning of orphan drug is very simple. So it is not given to the orphans who are not having that much money. So a drug which is useful for rare disease, the drug which is useful for rare disease are commonly known as orphan drugs. Orphan drugs. So this is the definition of orphan drugs, and here are the some of the list of the examples of orphan drugs. So remember with the tricks. So here these are the some of the list of the orphan drugs. Remember with the examples. So these are useful for the rare diseases. Rare diseases. So what is the normal value of HbA1c? So HbA1c, mathematically it is an indication of how much glucose binds to the hemoglobin. So HbA1c values are determinant factors of diabetes risk. Diabetes risk and how much percentage there is a diabetes in the particular patient. So HbA1c, like how oxygen binds to the hemoglobin, like that only the glucose binds to hemoglobin in the diabetic patient, especially in the patient suffering from the diabetes. So based on HbA1c values, we can determine how much the risk of diabetes in the particular patient. So normal value of HbA1c value is the normal value 6.5% to 7.5%, 6.5% to 7.5%. So especially, I already mentioned that the measurement of blood glucose level in the diabetes suffer from the variation due to dietary intake of the previous day. So blood glucose level, determination of blood glucose levels is also determined by HbA1c. HbA1c is nothing but glycosylated hemoglobin, meaning of glucose attachment to hemoglobin. If more amount of glucose attached to hemoglobin in diabetes patient, that is indication of high HbA1c levels. HbA1c levels. And here, this is a normal less than 5.7% and 6.5% or more, that is risk of diabetes, and pre-diabetes in the range of 5.7% to 6.4%. 5.7% to 6.4%. Next. So, a 70 kg woman was administered 1000 mg of drug. A 70 kg woman was administered 1000 mg of drug as IV bolus, intravenous bolus. After its uniform distribution in the body, the plasma concentration of drug was found to be 50 mg per liter. What is the volume of drug distribution? So simply here, the weight is 70 kg and administered 1000 mg of the drug as IV bolus, and the plasma concentration of drug was found to be 50 mg per liter. So what is its volume of distribution? So the answer is simply 20 liter, and by using this calculation you can easily understand. So the volume of distribution, the apparent volume of drug distributed in the body to provide same concentration as in the blood. So volume of distribution is given data in question. Administered drug is 1000 mg and plasma concentration is 50 mg. So simply 1000 by 50 is 20. That is 20 liter is the volume of distribution. 20 liter is the volume of distribution. 20 liter is the volume of distribution. So this is simply so administered drug by the plasma concentration 1000 by 50. 1000 by 50 nothing but 20. That is 20 liter is the plasma concentration. 20 liter is the plasma concentration. So like this questions definitely they will ask, but it is simply drug administered by plasma concentration and value that is next. The next MCQ is a hypertensive patient receiving a drug Y for managing BP was prescribed a tricyclic antidepressant. So, a hypertensive patient, the patient who is having hypertension, receiving a drug Y for managing blood pressure was prescribed a tricyclic antidepressant. As result, as result, there was an abolition of the anti-hypertensive action of Y. Which of the following drug could be Y? Which of the following drug could be Y? A hypertensive patient receiving drug Y for managing BP was prescribed a tricyclic antidepressant. As a result, there was an abolition of anti-hypertensive action of Y. Which of the following drug could be? As a result, there was an abolition of anti-hypertensive action of Y. Which of the following drug could be Y? So options are mentioned here like atenolol, captopril, clonidine as well as diltiazem, chlorидine as well as diltiazem. Okay. So here the answer will be the chlorидine. Answer will be the chloridine. So antihypertensive patient receiving drug well for managing BP was prescribed a tricyclic antidepressant. Generally, tricyclic antidepressants oppose the action of chloridine. Chloridine is a generally antihypertensive drug. Chloridine is a generally antihypertensive drug. So anyway, the answer for this MCQ is chloridine. Answer for this MCQ is chloridine. Especially tricyclic antidepressants decrease the function of chloridine by blocking tricyclic antidepressants and chlorpromazine abolish the antihypertensive action of chloridine probably by blocking alpha-2 adrenergic receptors as well as increase norepinephrine levels. Increase norepinephrine levels. The next MCQ. So regarding the next MCQ, put the events of acute inflammation in proper sequence. So put the events of acute inflammation in proper sequence. So directly I am going to the answer. So acute inflammation in proper sequence. So accumulation of fluid and plasma at the affected site, intravascular activation of platelets, polymorphonuclear neutrophils followed by the healing. So the events occurs in sequence in the acute inflammation in proper sequence. So first accumulation of fluid and plasma at the affected site, next intravascular activation of platelets, after that polymorphonuclear neutrophils followed by the healing, So this is regarding the acute inflammation information. Acute inflammation. So what is acute inflammation? What are the general features like that? Next MCQ. So regarding the next MCQ, which of the following is not an example of m-TOR inhibitor? So not an example of m-TOR inhibitor. So m-TOR, mammalian target of reclamation. M-TOR inhibitors are class of immunosuppressants. They suppress the immune system in autoimmune diseases. So which of the following is not an m-TOR inhibitor? Everolimus, tacrolimus, temsirolimus. So everolimus, sirolimus are having same pronunciation, and tacrolimus is a calcineurin inhibitor. It is also an immunosuppressant but not an mTOR inhibitor. Tacrolimus is an immunosuppressant, but tacrolimus not an mTOR inhibitor. So the answer is very simple. Tacrolimus and cyclosporin are calcium urine inhibitor, and this is a detailed classification of immunosuppressant. Next, Alzheimer's disease is mainly because of neurodegeneration of following part of the brain: hypothalamus, midbrain, hippocampus, cerebellum. So Alzheimer's disease is mainly because of decreasing cholinergic neuron function in the brain develops Alzheimer's disease. So hypothalamus, midbrain, hippocampus, cerebellum. The answer will be the hippocampus because hippocampus is responsible for learning and memory. It responsible for remembering of our things. Hippocampus. Okay, Alzheimer's disease caused by neurodegeneration in the hippocampus, that is a part of the brain, and especially due to decreasing acetylcholine function, there is a development of Alzheimer's disease. Next MCQ. Which of the following? Next MCQ is which of the following has been found to act as a male contraceptive without affecting libido as well as potency? So, which of the following has been found to act as a male contraceptive without affecting libido and potency? Cyproterone acetate, gossypol, centochromanum, goserelin. So, which of the following has been found to act as a male contraceptive without affecting libido? Libido means the desire to participate in sexual intercourse, reproduction. So, gossypol naturally from the Gossypium herbaceum, that is cotton, and this gossipol is known as a male contraceptive without affecting libido and as well as potency. Libido as well as potency. So here are the different contraceptives from the males for the males like anti-androgens, estrogens, progestins, superactive, GnRH analogs, and the gossipol. Next, choose the most appropriate statement. Choose the most appropriate statement for the peptic ulcer disease caused by NSAID. Choose the most appropriate statement for the peptic ulcer caused by NSAIDs. So, as excess usage of NSAIDs may cause peptic ulcer, what is the reason? So, let's see the explanation. H2 antagonists offer rapid healing of ulcer provided the NSAID is discontinued. H2 antagonists offer rapid healing. Proton pump inhibitor given only if the NSAID is discounted. NSAIDs are strictly contraindicated with proton pump inhibitors. So choose the most appropriate statement for peptic ulcer due to NSAIDs. So why NSAIDs cause peptic ulcer? Because they inhibit the COX-1 enzyme. Inhibition of COX-1 enzyme decrease the ulcer healing capacity. So here the answer is H2 antagonist offer rapid healing. Choose the most appropriate statement for peptic ulcer disease caused by NSAIDs. Next, lateral geniculate nucleus is associated with. So this is like anatomy question. So lateral geniculate nucleus is associated with options like vision, hearing, olfaction, gestation. So lateral geniculate nucleus is associated with simply vision. Vision is associated with the lateral geniculate nucleus. And here in detail explanation. So regarding lateral geniculate nucleus, and hearing is associated with the medial geniculate nucleus, and olfaction associated with the olfactory bulb, anterior olfactory nucleus, and gestation taste associated with the solitary nucleus and insular cortex. Next, which of the following drug used in chemotherapy of some of types of leukemia satisfy the statements? So next MCQ, which of the following drug used in the chemotherapy of some types of leukemia, blood cancer, satisfy the statements? Statement 1, effective orally. Statement 2, it has near 100% oral viability. So, in light of the above statements, choose the correct answer from the option given below. So, one of the drug helps in the treatment of blood cancer, especially leukemia, and the drug effective orally. The drug has 100% viability. The options mentioned here: asparginase, doxorubicin, mitomycin, as well as hydroxyurea. So most probably that is a new category of drugs, nothing but hydroxyurea. So hydroxyurea, nothing but simply addition of OH to the urea, addition of OH to the urea that become anti-cancer drug. This anti-cancer drug effective in treatment of leukemia, and this drug effective orally with 100% viability, that is advantage for any drug. Viability is good, that having excellent efficacy in different pharmacological action. So hydroxyurea, asparagines, doxorubicin, mitomycin. Doxorubicin, mitomycin both are anti-cancer antibiotics. Asparagines is an enzyme preparation of anti-cancer drug. And hydroxyurea is a miscellaneous category of drug. Hydroxyurea act on S phase of the cancer cells and inhibit the DNA synthesis in the cancer cells. Next MCQ is regarding next MCQ. The next MCQ given below are two statements. So in the two statements, statement one is in vasospastic angina, the imbalance occurs when the myocardial oxygen requirement increases during exercise and coronary blood flow does not increase proportionately. Vasospastic angina. So vasospastic angina, that is the angina because of spasm to the blood vessel, constriction, uneven constriction of blood vessel, that it decrease blood flow to the heart, myocardium. And statement two is in prinzimetal's angina, oxygen delivery decrease as result of reversible coronary vasospasm. Reversible coronary vasospasm. In light of the above statement, choose the most appropriate answers from options given below. Choose the most appropriate answers from the options given below. So both the statement 1 and 2 are correct. Both the statement 1 and state are incorrect. Statement 1 is correct, but statement 2 is incorrect. Statement 1 is incorrect, but statement 2 is correct. So simple logic. Vasospastic angina is also known as Prinzmetal's angina. So actually regarding the terminology, both are same, like other name, like vasospastic angina, Prinzmetal's angina, coronary vasospasm, like that. So simply what is happening because of this vasospasm, uneven constriction of blood vessel, there is a decrease in blood flow, oxygenated blood flow. But regarding the statement here, the statement 1 is incorrect, statement 2 is correct. Statement 2, in Prinzmetal's angina, oxygen delivery decrease as a result of reversible coronary vasospasm. Vasospasm, constriction of coronary artery, constriction of coronary artery. So this is the example. So angina, types of angina. So here, classical angina, variant angina. Next, in ECG, the P wave corresponds to following. So electro ECG. So which shows how the heart is working. So in ECG, the P wave corresponding to the following: atrial depolarization, ventricular depolarization, atrial repolarization as well as ventricular repolarization. So this is very easy MCQ. You know already from the basics itself. In the ECG, the P wave is corresponding to the atrial depolarization. Depolarization means influx of sodium into the cell and activation of cells. Here increase the heart contraction, nothing but heartbeats. So here ECG electrocardiogram. So it's the simplest and fastest test to evaluate the heart function. So with the P wave, so P wave depolarization of atria, P wave depolarization of atria. PR interval, delay AV node to allow filling of ventricles. ST segment, beginning of ventricle repolation should be flat. QRS complex, depolarization of ventricles triggers main pumping contraction. So next MCQ. Regarding the next MCQ, have a look on this MCQ. Which of the following cranial nerve helps in the accommodating the eye for near vision? Oculomotor, optic, trochlear, facial. So oculomotor, optic, trochlear, facial. So here oculomotor is there. So oculomotor means eye and optic also eye. So which of the following cranial nerve helps in the near vision? So near vision, nothing but definitely it is the answer belongs to the oculomotor. So vision with help of motor neuron from the central nervous system. for near vision accommodation. And here detailed about different cranial nerves, their nature of the cranial nerve and their functions with a easy trick. With a easy trick. Next, which of the following is true for bone tissue cell differentiation and maturation? So, which of the following is true for bone tissue cell differentiation and maturation? Differentiation as well as maturation. So, differentiation means dividing rapidly and maturation ready for the function. So, osteogenic to osteoblast to osteocyte. Osteogenic to osteoblast to osteoblast. Osteocyte to osteogenic to osteoblast. Osteoclast to osteoblast to osteocyte. So, here which of the following is true for bone tissue cell differentiation and finally maturation. Finally, maturation. So mostly osteogenesis, after that osteoblast, after that osteocyte. Osteocytes are nothing but they are matured, nothing but they are matured bone cells. So the answer will be the simply option 1. So genesis first bone cells, osteogenesis, after that blast divided, after that matured bone cells, nothing but osteocytes will be produced. Option A is the correct. Option A is the correct. So osteogenic cells are the stem cells responsible for bone growth and repair, and osteoblast cell that forms a bone tissue, osteocyte mature bone cells, osteoclast break down the bone tissue, osteoclast break down the bone tissue. Next. So again, a tricky question is ready for you. So what is the tricky question? A drug X is more selective for subunit of benzodiazepine receptor. It lacks effect on slow wave sleep, minimum residual daytime sedation, no rebound insomnia or disconnection, low abuse potential. Which of the following drug should be X? So, a drug X is more selective for subunit of benzodiazepine receptor. It is a acts on subunit of benzodiazepine receptors. It lacks effect on slow wave sleep. No effect on slow wave sleep. Minimum residual daytime sedation. So there is a chance of minimum sedation during daytime because of this drug. No rebound insomnia. Insomnia, lack of sleep. So no rebound insomnia. Even if the drug usage stopped, no insomnia comeback. No comeback of insomnia again. And there is a chance of low abuse, less addiction potential. Less addiction potential. Flurazepam, a benzodiazepine. Flumazenil. Flumazenil is an antidote for benzodiazepine poison or overdose of benzodiazepine can be treated by flumazenil. And melatonin. Melatonin is a agonist on melatonin receptors, a sleeping hormone. And zolpidem. Zolpidem is a non-benzodiazepine category. Zolpidem is known as non-benzodiazepine category. Benzodiazepine, non-benzodiazepine both are having same mechanism, agonist the GABA receptor, but both differ in their chemistry. So zolpidem is binds to the subunits of benzodiazepine receptor. Zolpidem is a non-benzodiazepine and zolpidem does not having any addiction or abuse. Abuse nothing but misuse. Abuse nothing but misuse. Answer is the zolpidem. Answer is the zolpidem. Zolpidem binds to the non-benzodiazepine receptors. Which of the following is a fourth generation cephalosporin? Which of the following is a fourth generation cephalosporin? Ceftriaxone, third generation, cefaclor, second generation, cefuroxime, third generation, cefepime, fourth generation, cefepime, cefepirone are fourth generation cephalosporins. Fourth generation cephalosporins. Cefepime, cefepirone, cefepirone. So this is the detailed table of examples of each class of each generation of cephalosporin. So, cefepime, cefpirone are fourth generation, and also observe this table with different examples from the different generations. Next MCQ is which of the following metabolite used to inactivate vasicotoxic metabolites leading to hemorrhagic cystitis by alkylating agents used in treatment of cancer. So, which of the following metabolite used to inactivate vasicotoxic metabolite leading to hemorrhagic cystitis by alkylating agent used in treatment of cancer? So, acrolein, aldophosphate, cyclophosphamide, mesna. So, hemorrhagic cystitis is a major drawback of cyclophosphamide the cyclophosphamide converts to different metabolite, alcoholin as well as aldophosphate. Okay, so here simply the answer will be the mesna. So which of the following metabolite is used to inactivate the vasculotoxic metabolite leading to hemorrhagic cystitis by alkylating agent used in treatment of cancer? So cyclophosphamide is an anti-cancer drug. It produces side effect hemorrhagic cystitis. So for treatment of hemorrhagic cystitis, mesna is an antidote. Mesna is an antidote for hemorrhagic cystitis caused by the cyclophosphamide. Cyclophosphamide. The antidote for poisoning of cyclophosphamide is mesna. What is chemically mesna? 2-mercaptoethane sulfonate. Cyclophosphamide gives aldophosphate. Aldophosphate again gives phosphoramide mustard, a anti-cancer compound, and acrolein is a toxic metabolite causes hemorrhagic cystitis in the urinary tract. So pain in the urinary tract, appearance of the blood in the urinary tract. So acrolein is toxic metabolite causes hemorrhagic cystitis, and acrolein is a metabolite of cyclophosphamide. So for overdose or treatment of poisoning of cyclophosphamide, mesna will be useful. Mesna will be used as a antidote. Mesna 2-mercaptoethane sulfonate. 2-mercaptoethane sulfonate. Next. So regarding the next one, all of the following are true with metoclopramide except. So serotonin 1 receptor antagonist, type 2 dopamine receptor antagonist, serotonin type 3 receptor antagonist, serotonin type 4 receptor agonist. So all of the following are true except about metoclopramide. Serotonin 1 receptor antagonist, type 2 dopamine receptor antagonist, type 2 type 3 and serotonin type 4. So among these the exception will be the option A, that is not A. Metoclopramide not be a serotonin 1 receptor antagonist, but block dopamine 2 receptors, serotonin 3 receptors, serotonin 4 receptors. Okay. So metoclopramide by agonizing serotonin type 4 by blocking dopamine type 2 by blocking serotonin type 3. It may also increase the acetylcholine secretion from the myenteric motor neurons. Myenteric motor neurons present in the gastrointestinal tract muscles. Gastrointestinal tract muscles, and especially this metoclopramide is a prokinetic. Increase the movements of gastrointestinal tract. And this metoclopramide also for prophylaxis of vomiting, to control vomiting, So let's have again the interesting tricky question here. So the interesting tricky question here, let's have a look. Statement 1. Levodopa metabolized peripherally but capable of crossing the blood-brain barrier, thus a best drug in treatment of Parkinson. Levodopa metabolized peripherally but capable of crossing blood-brain barrier. Once it is metabolized peripherally, it converts to active dopamine. That active dopamine should not cross the blood-brain barrier. It is a best drug in the treatment of Parkinson, so that is okay. And statement 2. Carbidopa crosses blood-brain barrier, thus a best combination for protecting levodopa. Okay, yes, carbidopa can protect the levodopa from the degradation. So, in light of the above statement, choose the correct answer from the options. Both statement 1 and statement 2 are correct. Both statement 1 and statement 2 are false. Statement 1 is true, statement 2 is false. Statement 1 is false, statement 2 is true. So, you know that levodopa is a drug of choice for treatment of Parkinson's. Statement 1 is true, but statement 2 is false. Levodopa metabolized peripherally but capable of crossing blood-brain barrier by converts to dopamine. Thus, best drug in the treatment of Parkinsonism. So, statement 1 is true, but statement 1 is false. Next, simply levodopa converts to dopamine in the brain, and in the brain, the dopamine binds to the dopamine receptor and helps in the controlling the risk of Parkinson. And this question is also dropped because of some reasons. So, which of the following is a tetracycline antidepressant? Tetracycline antidepressant has additional type 2 dopamine receptor blocking and the neuroleptic properties as well as greater tendency to cause seizures in overdose. Which of the following is a tetracycline containing four cyclic ring structure antidepressant with additional blocking property of type 2 dopamine receptor and neuroleptic properties. So may have little bit antipsychotic like properties with a greater tendency to cause seizures in overdose, especially most of the tricyclic antidepressants may cause seizures, but here there is asking a tetracycline antidepressant. Tetracycline antidepressant. So the tetracycline antidepressants definitely will be that is a antipsychotic action like also. Okay. So here the answer will be the trazodone. The answer will be the trazodone. So trazodone is the answer. It is the first atypical antidepressant efficiently blocks serotonin uptake but has prominent alpha blocking and also weak serotonin type 2 antagonistic action. Serotonin type antagonistic action. Sorry for inconvenience. The answer will be the amoxapine. Amoxapine is a tetracycline compound. Tetracyclic compound means having a tetracyclic compound means having four cyclic ring in its structure, and this amoxicillin can block the type 2 dopamine receptors and also addition to inhibiting the noradrenaline reuptake. This amoxicillin having the ability to cause the convulsions also. So this is end of our MCQs with explanation session from the Gpat 2023. From the Gpat 2023. I hope you enjoyed and you understand the along with the detailed explanation. So for this purpose, so first of all, subscribe to our GDC English classes. Definitely share this video to your students who are preparing to GPAT like you, and don't forget to subscribe and continue your preparation. Keep maintain your rhythm and whatever it may be. So GDC is always with you. So GDC is always come up with a daily interesting content like this, and we post in this channel. So for that purpose, subscribe and definitely like our channel and share to your friends also and follow for the daily updates. Thank you.